Hello and welcome. You're listening to Health and Image. I'm your host, Stephanie, and today we are talking about PTSD. I am talking with a premier clinical psychologist and leading trauma specialist, Dr. Kirby Reutter, and he's going to answer some questions for us. So, Dr. Kirby, how are you? Welcome to the show.
I am doing well, Stephanie. Thank you so much. It's great to be here.
Oh, good. So let's just start out with, first of all, for those who don't know, I mean, I'm pretty sure this is a pretty general term, but what is PTSD?
I'll start off with a pretty general explanation. I actually see PTSD as a normal reaction to an abnormal event. Even though you feel like you're off kilter when you've been traumatized, really everything you're experiencing is completely normal. What was abnormal was the event that triggered it. Slightly more technical way of looking at PTSD is when we've been traumatized, when we're experiencing the trauma itself, our brain's fight, flight, and freeze response has been activated. PTSD results when we continue to have that fight, flight, freeze response with everything else in life. I like to also think of PTSD as kind of the trauma after the trauma. If you were, say, raped by a coworker, obviously the rape itself is going to cause issues. But then if you continue to have, say, flashbacks, during the day, work day, or nightmares at night, it's those symptoms that keep going that end up causing even more problems than the original trauma. And that's kind of what PTSD is all about.
I gotcha. So you did give an example of, a person who might get that, but, who else gets this? What are some examples of someone who might be suffering from it?
The short answer to that is pretty much anyone can potentially get PTSD. In the U.S. alone, about almost 9% of the population will experience PTSD at some point in their lives. In fact, PTSD can be diagnosed as early as a baby's first birthday. So when I say anyone, I pretty much mean anyone. However, there are certain populations that tend to receive the diagnosis more than others. So some pretty typical populations that are diagnosed or tend to be diagnosed with PTSD would be veterans, police officers, firefighters, emergency medical personnel. But then also, since I used the example of rape, survivors of rape also tend to have more PTSD diagnoses than the average population.
Are there any other kind of events that might cause it?
Yeah, pretty much anything that just kind of shatters your reality. So it doesn't have to be something as, dramatic as going to war and doing a tour in Iraq for a year. It doesn't have to be as dramatic as repeatedly getting raped. It could even be witnessing domestic violence in others.
Yeah.
So it's not even something you have to receive yourself. Or, to use the example of, I use the example of police officers and firefighters. Sometimes people experience PTSD because of all of the trauma other people are experiencing. That's sometimes called vicarious PTSD or secondhand PTSD.
So can you tell me some of the symptoms? Like, do people know that they have it or that they're experiencing it all the time? Or is that something that sometimes, when they come in and talk to you and you're like, you have PTSD and they didn't even realize it?
It can go both ways. So for people that are kind of mental health savvy, they might know some of the symptoms they're experiencing.
Yeah.
But other people don't. Other people, they just feel off. They feel like something's out of whack. When we talk about, some of the technical symptoms of PTSD, there's 4 main categories or clusters. One cluster of symptoms is when the original trauma keeps happening over and over again in different ways, keeps repeating. So one way is for the trauma to keep repeating in your own mind, so in your memories. You just have random memories of the event.
Yeah.
You can also even have actual flashbacks in which you feel like the actual event is happening all over again. Another way that can happen, or another way that trauma can keep going on and on, is when you have really intense either emotional or physical reactions to triggers. So triggers basically anything that resembles the original trauma. But then in kids, there's an interesting way in which the trauma can keep playing out. And that is, with kids, a lot of times the original trauma will play out literally in their play. So for example, if, say, a boy has been sexually abused, he might start to do inappropriate things on the playground.
Right.
While he's interacting with other kids.
Right.
So those are all examples of reoccurring. there's other clusters. So another cluster of symptoms is avoidance patterns. So after someone's been traumatized, they want to avoid everything that even remotely resembles the original trauma. They'll even start to avoid their own thoughts and feelings, but then they also avoid people, places, certain topics, activities, even certain objects or situations, anything that kind of sort of resembles the original trauma, they want to stay away from. Another cluster of PTSD symptoms is some pretty dramatic changes in thoughts, emotions, even memory itself. So after someone's been traumatized, for example, they tend to have much more negative beliefs about themselves, about other people, about the world. One example of that is a lot of times the person that's been traumatized will start to blame themselves for the original trauma, even if they had nothing to do with it. Something else that can happen with people that have been traumatized is that they start to have more negative emotions. So, for example, more fear, more anger, more guilt, more shame. And then on the flip side of that, they also have less positive emotions. So, for example, less excitement, less joy. And because of some of these symptoms, people have been traumatized. Sometimes they also start to lose interest in things that they used to love to do.
Yeah.
So, for example, if you used to love to fish, but then you almost drowned fishing, well, you're probably not going to enjoy fishing for the real time. The final cluster of symptoms is a lot of times this is called arousal and reactivity. So basically, what this means is that fight and flight response is just constantly activated, even if the trauma has already ended. What happens with that is people are just more irritable.
Yeah.
So they might have more angry outbursts. There might even be some verbal or physical aggression, more reckless or self-destructive behavior, something that's called hypervigilance, in which someone is just constantly on super alert. Their radar is always on for any possible danger.
Yeah.
And part of that is also what's sometimes called this exaggerated startle response. So in other words, just the slightest thing will kind of freak them out and overreact. And not surprisingly, since flight is constantly activated, people with PTSD have a really tough time concentrating.
Yeah.
They're always on edge, flashbacks. And then, not surprisingly, they also have a tough time sleeping at night because of these nightmares and all these other symptoms going on.
So how long does it last? I mean, I'm sure it's different, if you don't get treatment versus when you do. But what kind of insight can you tell us about that?
So you're absolutely right. There's a huge range here. The symptoms have to last at least 1 month in order to be diagnosed. But in about half of adults, they just recover from PTSD symptoms a lot of times on their own within 3 months. But then the other half of adults don't.
Yeah.
And what makes the huge difference there is whether they've been treated or not. Untreated PTSD tragically can actually last a whole lifetime.
Oh.
For example, I've been doing some geriatric work this last year, and so I've worked with geriatric patients, people in their upper years of life that still have PTSD symptoms from events that happened decades ago.
And so can you tell me a little bit about, are there effective ways to treat PTSD?
There's many really good models out there. One model for treating PTSD is EMDR, which stands for eye movement desensitization and reprocessing. Another really good model out there is called TFCBT, which stands for trauma-focused cognitive behavioral therapy. Another good model out there is called DBT, which stands for dialectical behavioral therapy. Yet another model that's used to treat PTSD is called prolonged exposure. There's different ways of going at it. So all of these models that I mentioned definitely have certain pros, certain cons, but there's also lots of overlap. So every trauma model has very similar approaches, but then also goes about it from a different angle.
Right. Can you tell us, just maybe a little bit more information about the different treatments? I mean, because I know there's going to be patients out there who maybe they're suffering from this, but they're like, therapy can't help me. I'm just going to deal with this forever, and I don't think that's the case. I think they can get help. And, I mean, is there any, just some more details you could give us about the different treatments?
So with EMDR, it's a very unique model, but it's all about helping someone process a traumatic memory by having them activate eye movements. The theory behind why that works is when we sleep at night, we have, and especially when we dream, we have rapid eye movement.
Yeah.
A lot of scientists think at night when we're sleeping, that's when we process, a lot of what happened to us during the day or, throughout our life. But certain memories kind of get stuck because they're so traumatizing. When we help activate some of the eye movement while they're awake, that can help the memory get processed.
Wow.
TFCBT is a model in which you teach someone basic coping skills, and then you have them tell the narrative of what happened. And then after that, you process with them, any thinking errors that they might have about the original trauma. For example, I mentioned earlier that people who've been traumatized tend to blame themselves inappropriately.
Yeah.
So that's one of the thinking errors that gets processed. DBT is basically an entire model of coping skills. DBT itself doesn't really help process the trauma, but it teaches all kinds of coping skills to deal with triggers, basically help people stabilize and self-regulate so that they can go on and do more trauma work.
Yeah.
So another example of a trauma model is, like I mentioned before, prolonged exposure. So that's basically when the client tells the traumatic event over and over and over again to the point where they're desensitized to it. In other words, it's no longer triggering for them.
I know you kind of touched on this a minute ago, but do children react differently than adults who are experiencing it?
With children, the symptoms are very similar, but there's one key difference that I already mentioned, and that is with children, the trauma tends to come out more in their play. So that's one way you might know that a kid has been traumatized.
Yeah.
But another difference between kids and adults is that when kids are experiencing PTSD symptoms, a lot of times those different symptoms that I talked about earlier will get diagnosed with other disorders. For example, remember I mentioned that one of the PTSD symptoms is difficulty concentrating.
Yeah.
Well, if a kid is having difficulty concentrating, they're probably going to get diagnosed with ADHD.
Yeah.
But remember, I also mentioned that someone that has PTSD has fewer positive emotions and more negative emotions. In other words, PTSD also resembles depression.
Yeah.
And remember, I also said that someone that's been traumatized is more irritable, more aggressive, can be more belligerent. Well, if this happens with a kid, they're going to tend to be diagnosed with, say, oppositional defiance. Or if they've been traumatized, they're probably also having trouble sleeping at night. So they might get diagnosed with insomnia. So my only point is, a kid that's been pretty traumatized, but no one has done a comprehensive interview yet with them, they might end up with up to 5 different diagnoses. I did residential work for 7.5 years, and I came across this phenomenon so much that I even called it the 5-3 rule. When a kid was referred to me for residential, and I started going through their file, a lot of times I came across 5 different diagnoses, and they were on 3 different meds. But then when I finally interviewed them and figured out what had happened to them, I realized they don't have 5 different diagnoses.
Right.
They have PTSD.
And then so you treat them from there, and then do they seem to do better, maybe dropping some of the ADHD medicine and all of that and focusing more on the PTSD?
Sometimes the meds are still helpful because they can kind of take the sting off of some of the symptoms enough to actually treat them. But yeah, if you're only medicating the kid when the kid has PTSD, but not providing them the trauma work that they need,
right,
then the meds are only going to go far.
Right, you're not getting to the root of the issue.
Exactly. Yeah.
I have one last question for you, Dr. Reutter. I'm going to give you a chance to brag here. Why should a patient choose you for help with their PTSD?
Well, I don't know if I'm going to completely bite on your offer to brag, but I will offer some advice to people looking for a therapist, and that is you really want to find a therapist that's a good fit for you. Yeah. I mean, this is a free market economy, and there's many therapists out there, so you don't want to waste your time with someone that's not a good fit.
Yeah.
But having said that, your therapist has to have a good balance between being knowledgeable, competent, but also relatable. And especially, speaking of a a therapist that's knowledgeable, especially when it comes to trauma work. You really want someone that's trained in more than one model.
Yeah.
In fact, I would say multiple models. So for example, there's many therapists out there that say, I am an EMDR therapist, or I am a TFCBT therapist, or I am a DBT therapist, or a prolonged exposure therapist. And that's great if they have training in one model.
Yeah.
But in my opinion, that's not enough, because trauma is so complex that it affects everyone differently. And so there's no model out there that's going to be a good fit for everyone. So, something that you'll notice in the field of psychology is some psychotherapists can become a little bit dogmatic, that their model is the best.
Yeah.
Well, that's not true. It might be the best for some people, but not necessarily the best for everyone. So you really want someone that's fluent in multiple models. So if one model is not working, that therapist can just switch to another model.
Well, this has been great. Thank you so much for coming on today, Dr. Reutter.
Thank you, Stephanie, for allowing me the opportunity.
Of course, it's been really helpful. If you have questions, definitely be sure to reach out to Dr. Reutter. You can also get his book on PTSD. There's some great information in there. Until next time, thank you for listening.